Yeah, Laurel, there certainly are those who are vaccinated and in good health, but just by sheer volume, there are many who are not doing well.
Clark County hospitals facing what may be their biggest COVID challenge yet, at least in terms of the numbers of patients needing treatment.
They are under strain for many different reasons. And a COVID-19 surge, unfortunately, is going to make all that worse.
This past week, nearly 97% of regular hospital beds in Clark County were occupied, while 98.4% of ICU beds were in use. About 18% of regular hospital beds have COVID patients, while 25% of ICU beds are COVID cases. At Legacy Salmon Creek, they are once again adjusting to meet the needs.
Healthcare is a dynamic resource that we stretch to fit the need. So we get creative. And, if you look behind me, you'll see we have tents set up to add additional capacity. And that's the way we work in the ER and in the hospital as a whole.
The case numbers show the surge is not over, with an additional 6,100 cases in the past week. Cases per 100,000 residents is up to a record high, 1,679, from 715 last week. And there have been an additional 14 deaths reported. It is true for the majority of us, Omicron may not be that bad if we get it. But spreading it to the unvaccinated and those with compromised immune systems is the biggest danger. So what can you do? Test if you can, but unless you're sick, avoid the ER.
So if you don't have any symptoms, you just need a test. The emergency room might not be the best place because we want to reserve that for folks that are having symptoms and have an emergency that needs to be evaluated. But also to emphasize that we're always here and want to see anybody anytime for what their needs are.
We do know overall, Omicron is less likely to send someone to the hospital, but people are still going. People are still getting sick enough to have to go. And that creates problems for everyone.
Public Health's Dr. Stephen Krager hopes people will stay home if they test positive or have symptoms and wear a mask around others after your isolation time is done. Although some models show the surge could be close to peaking, it's not there yet in most places, including Clark County.
From our data right now, we haven't seen a slowing that might suggest a crest. It doesn't mean it's not going to come in the next few days. It's certainly possible. But right now, it's too early to say. I hope that it happens. The sooner it happens and the sooner we can get kind of on the downside of this surge, the better.
And late yesterday, Washington Governor Jay Inslee put out an emergency order limiting some medical procedures so the focus could be on COVID. He also ordered up the National Guard to help some hospitals. So far, not in Clark County, but that could change. Laurel?